talking about primary health care in Africa and some of the great stuff Last Mile Health is doing to help that work even better.
My name's Raj Panjabi. I am a physician and I am the CEO of Last Mile Health, and our work is to train, equip, and pay people from remote communities as healthcare workers, essentially go door to door to bring healthcare to their neighbors' doorsteps. My parents immigrated to Liberia from India in the 70s. I was born there and raised there until the age of 9 when a horrific civil war drove hundreds of thousands of people, including my family, out. During medical school, I went back to Liberia to see if I could serve the people we'd left behind. There were just 51 doctors for a country of 4 million people. In rural parts of the country, I was seeing my patients die from conditions really no one should die from in the 21st century: pneumonia, malaria, simply because they were living days from the nearest clinic. I started Last Mile Health to save lives in the world's most remote areas. Last Mile Health literally means healthcare for last mile community. Things like testing a child for malaria, or treating a child for pneumonia, or using a measuring tape to screen a child for malnutrition, helping a mother organize a birth plan so she can deliver in a clinic. These are interventions that are proven to save millions of lives. What we've seen is that if we invest in how they're trained, equipped, and pay them instead of considering them as volunteers, you can have some dramatic results. The Community Health Academy hopes to modernize the education of community health workers using digital content to create the largest army of community health workers the world has ever known. And community members are deeply motivated to serve their people. They want to learn. Over time, governments are willing to pay for these workers because they actually have a great return on the investment to society.
Digital training, I'd say that's very much on the cutting edge, and it's great to be trying that. You're doing some pioneering stuff, which is very exciting.
There's still millions of people dying from preventable causes. Creating a national workforces of community health workers, we could save millions of lives in those countries.